Welcome to Perspectives, a special presentation of the Power of the Patient Project. Today's guest is Emily Davis. And now, here is your host, Charlotte Grinnell.
Hi, I'm Charlotte Grinnell, and welcome to Perspectives presented by the Power of the Patient Project. My guest today is Emily Davis. Emily graduated from Temple University with a Bachelor in Social Work and is now earning her MBA with a concentration in Healthcare Administration at Holy Family University, also in Philadelphia. Her professional focus is on patient advocacy and is currently a patient advocate at Cancer Treatment Centers of America. Welcome, Emily. Thank you so much for agreeing to be here with us today.
Thank you for having me. It's a pleasure speaking with you, Charlotte.
Yeah, thank you. Would you mind by starting with just telling us a little bit more about the Cancer Treatment Centers of America?
Yeah, of course. So Cancer Treatment Centers of America is a nationally accredited oncology network of hospitals and outpatient care centers. It's an industry leader in patient satisfaction, and CTCA offers a coordinated approach to care that combines surgery, radiation, chemotherapy, immunotherapy, and advancements in precision medicine with supportive therapies that are designed to manage side effects and enhance the quality of life during treatment and into survivorship for patients. And I've been with CTCA for over a year, and honestly, I have loved every minute working with that organization.
It sounds like an amazing organization, and I know that you guys are kind of focused on supporting the mental health of patients, both cancer patients as well as patients throughout the country during the pandemic. Mm-hmm. And so what are some evidence-based techniques to support reducing stress and anxiety?
Sure, yeah. So this is definitely a very popular question, especially during times of COVID, and there's a lot of uncertainty. And then, of course, the people that I'm working with every day are patients that are newly diagnosed with cancer. So taking a global pandemic and a new cancer diagnosis together is very overwhelming and very stressful. So it's great to know different types of techniques to help reduce your stress and anxiety. And of course, every person is different. So some techniques work better for others, and some may not necessarily work as much for another person. So some of the techniques that I've collected over time, these techniques that I'm going to share with you, they're from the National Center of Complementary and Integrative Health, as well as the American Psychological Association. So one that a lot of people know about is exercise, as well as yoga, which is a form of exercise. So there's a range of research that has examined the relationship between exercise and depression, as well as stress and anxiety, that it may be helpful for your mental health. So this is something that I try and incorporate every day in my daily life, getting 10,000 steps a day on my Fitbit, or getting outside, getting outdoors, or doing some exercise indoors. I do yoga indoors, so that's a great technique. Another technique that's becoming more popular, a lot of people are educating themselves more on this, is mindfulness-based meditation. So mindfulness-based meditation, it's a type of meditation in which you focus on being intensely aware of what you're sensing and what you're feeling in that moment without interpretation or judgment. A lot of people say it's focusing on your breathing. And some research suggests that practicing meditation, it can reduce blood pressure, it can reduce anxiety, depression, and even insomnia. So I use this app called Headspace on my phone. There's a few different apps that support with guided meditation. There's another one called Calm. So usually when you're starting out with this, a lot of people are unsure how to start. And I usually recommend to people look up a clip on YouTube or do a little bit of research and do a guided meditation first. And eventually you can do it on your own without any guidance. Another important thing for reducing stress, anxiety, supporting your mental health would be cultivating a social support group. And this could be your friends, your family, can be your coworkers, anyone that you feel connected with, or a therapist. And it's important to note that giving support is just as good as getting support. So helping someone, giving back to community, and research suggests that this can cultivate positive emotions and decrease negative emotions. Another technique would be practicing good nutrition. So this is something that a lot of people know, that your diet and what you put in your body, it can really affect how you feel each day. So when our body is confronted with a stressor, the central nervous system releases adrenaline and cortisol, which affects the digestive tract, among other physiological changes. Acute stress can kill the appetite over time, but the release of hormone cortisol during a chronic stress can cause fat and sugar cravings. That's why you know some people say, I'm craving sugar, I'm craving chocolate, or I'm craving something salty when you're really stressed out. And it's important to recognize those cravings and realizing that you may not be actually hungry for it, but it might be your body reacting to stress. And then the last technique that I think is very important and gets overlooked by a lot of people because it's so simple is sleep. It's so essential to our bodies, especially when it comes to maintaining our mental health. So it's important to set a sleep schedule, try and go to bed at the same time every night, try and wake up around the same time every day. And I'm sure a lot of people have heard this, but to turn off your blue light. So blue light from your computer screens or your phones, they can suppress your sleepy hormone, melatonin, and prevent you from having a good night's sleep. Also, avoiding caffeine and alcohol intake prior to going to sleep as well. So those are just some tips, and I think they work very well for me. They're different for every individual, but it's great to kind of test each one over time and see what works best for you.
Yeah, those are really great tips, and I feel like a lot of those correlate and go along with each other. Like if you have a good balanced diet and it kind of goes along with getting sleep and exercising, and when you're being present, it's more likely that you're not going to be on your phone right before bed. So it's like those all kind of go in with each other. So it was kind of an easy way to think of it in terms of incorporating all of those, because it sounds like a lot of things, but then when you realize that they all kind of go together, it'll be easier to incorporate in your daily life.
Exactly. Like you mentioned with the mindfulness, even being mindful with what you're eating or what you're putting in your body, the more you focus in the moment, like you said, the less likely you are to be distracted on your phone or be distracted from going to sleep. So I totally agree. They really intertwine with each other.
Yeah, and could you tell us a little bit more about your role as a patient advocate, and what do you do, and why are patient advocates so important to improve the patient experience?
Sure, yeah. So a patient advocate is a representative for patient rights and responsibilities. So my goal as a patient advocate is to make sure that patients, when they come in, especially at CTCA, new diagnosis, that they are feeling empowered when making decisions, asking questions, and choosing a treatment plan. So like I mentioned before, this can be very difficult with the new stress of having a new diagnosis, as well as all the new information coming in about what's going on. So it's important for every individual that they understand their options for care, that they know what's going on, and that their care team understands their interests, their values, and their goals when it comes to their treatment plan. So my role is to make sure that patients are receiving the care that they deserve, as well as the fact that they feel comfortable with the decisions that they are making and that they're well informed as well.
Yeah, definitely. And I think that, I heard this in one of the other interviews that we were doing, but kind of patients being an active participant in their own treatment process instead of a passive patient. And that kind of goes into what you were just saying, in kind of not just having a voice in what's happening, because it is about you, your treatment, and how you want it to go. So sounds like
Absolutely.
a great thing.
And this kind of goes hand in hand with having that strong support system.
Yeah.
If you have the ability to have a caregiver with you or someone to be your advocate for you, because some days, let's be honest, if you're not feeling well, you're not yourself. You may not think about all the questions that you thought about when you were well. So it's good to have your family, your friends, whoever it may be an advocate for you. Luckily enough, my role as a patient advocate, I can step in and be that advocate for patients if they don't have family members or they don't have a spouse to support them. So I always suggest to my family and friends, if you're going to a hospital or healthcare center, you have questions or concerns and they're not being addressed by your care providers, ask if they have a patient advocate, ask those questions, see what support and what resources are there to help you with your care plan.
Yeah, and this is kind of a big question, but as the pandemic continues, what are some of the things that we can do to cope over the next few months until, everyone is vaccinated and hopefully we can go back to somewhat normal lives?
Yes, yeah. Funny about the word normal. So obviously,
Yeah.
past year, it's put such a challenge on every single person. I feel like no matter where you've been in this past year, COVID-19 has had some type of effect on you, whether it's financially, emotionally, physically, a variety of different ways, whether it's society, healthcare, or just an individual. It's had an impact. And I think it's important that we recognize and that we understand that life is different. It's going to be different. It's different than it was prior to COVID-19. And it's important that we understand that having stress during this time, it's normal. It's going to happen, and to keep educated on what triggers our stress and what are different techniques that we can do to reduce this stress, and understanding when we feel overwhelmed. And something that I learn and continue to learn as I get older, and I think is difficult for some people, is to not be afraid to step back and say no to things that may make you feel physically uncomfortable or mentally uncomfortable. As you mentioned about the vaccine, I think it's important to speak with your primary care physician, educate yourself. If you are able to get the vaccine, talk to your doctor when it's available, get the vaccine, and recognize that life is going to be different moving forward. Hold on to your support system, whether that be FaceTiming your family, your friends, giving them a phone call, learning new technology, texting them, staying connected to people, because we have been so isolated from each other, whatever way it may be. Social media, that's a great use to stay connected to people. And then something that I always remind myself, and it kind of goes into that mindfulness, is to just be grateful and thankful of every day, and to recognize if you are healthy, that is such a blessing in itself, to have your health and to feel good each day, even though there's a lot of stress, to know that your physical health means so much at this time.
Yeah, definitely. Thank you so much for this interview. It was very informative, and I think that it's a really important message to get across to pretty much everyone right now, because as you kind of mentioned earlier, in some way or another, everyone's affected by this. And so to have those coping mechanisms are really helpful. So thank you so much for sharing those with us today.
Yeah, thank you for having me, Charlotte. Anytime, no problem. And stay safe and stay healthy.
Yeah, you too. Thank you so much.
Thank you. Have a good night.
You too.